welcome back everybody to the GuideWell Insights Lounge. My name is Kate Warnock and we're here at Singularity University's Exponential Medicine. We have an international guest with us right now, Miss Barbara Vanderkolk. Barbara, welcome to the interview.
Thank you.
Barbara is a member of the executive board and the lead of mobile doctors at VVAA. Barbara, well, that's just one of her titles. We were talking before, I think this woman probably runs half of the Netherlands.
No, I don't.
Based on your accountabilities, but Barbara, let's start with your questions. In the next 3 to 5 years, what will be the most significant innovation to change the way healthcare is delivered and why?
Well, what I think is that the combination of data on one hand and the combination of getting it out there to all the doctors and being able to share this information will accelerate, first of all, I think the learning curve of doctors, make it possible to see and acknowledge best practices in a very fast pace,
Right.
Which will hopefully save time as well. Because one of the points that we learn, at least in Holland, is that doctors crave for more time with their patients. And I'm hoping that these technologies will enable the doctors to have more time with the patients that need that time and that specific attention. And with all the technologies and data available, then the easy care, as far as there is easy care, can maybe be delivered either faster or patients can do it themselves on a distance and be more self-sufficient and in control. So that's what I hope for.
Absolutely. Well, Barbara,
Yeah.
I mean, I think that the theme that you talked about as far as clinicians really being able to spend more quality time with their patients, I think that is a universal request.
Yeah.
So the fact that that's particularly...
We did a large survey amongst all our doctors, and we are, VVAA is like USAA in the United States,
Yes.
but then we deliver the same kind of portfolio, but then for all medical doctors. And we did a survey and we learned that one of the biggest detractors for passion for their profession was the lack of time that they can spend with their patients. So I'm hoping, and I'm very hopeful, learning everything that I've learned for the last couple of days, that this will really help push it forward.
Absolutely,
Yeah.
especially with the population that you serve. I know that you have many, many members, don't you,
Yeah.
that would benefit from this. Barbara, our next question then, do we have to be sensitive to a digital divide where some have access to mHealth tools while others don't? How do we avoid actually creating a new healthcare disparity?
I'm not really sure, because it's quite a difficult question, but I think it will start, first of all, with co-creation. I think any solution that is being co-created with patients will help pushing it or bringing it to the patients and to other people, because it's been developed by them and for them.
Right.
So that would be one. First, secondly, I think it should be affordable. So I think any solution has to have some sort of earning model or economical model that makes it affordable for the larger public.
Right.
And whether insurance companies should or could play a role in it, I'm not sure. We were discussing last night with a couple of the attendees that it would be maybe a good idea to invite insurance companies to venues like this, so that they can see what is going on and how it can help their business, but also how they can contribute to distribute
Absolutely.
affordable care.
Because they can be part of the solution then, can't they?
They can be
That's
part
right.
of the solution. I think they should be part of the solution.
Right.
It's like Lucian Engelman said, it's not an ecosystem, it's an ecosystem. So you need all parties to cooperate and think of bigger solutions to bring these technologies to a wider public.
I think that so many people would agree with you. You know, you yourself as a leader, and you have such a diverse portfolio that you manage at VVAA. What advice do you have for leaders looking to start companies that change healthcare?
Well, first of all, look at the people. The technology is one thing, but the people driving it at the core, they should be people that are easy to work with, because I think in this world, more than maybe anywhere else, cooperation with different parties, with different backgrounds is a necessity to make it a success. So first of all, look at the people. Secondly, I would look at, is it developed with patients? And if it's not developed with patients, is it developed with the users?
Right.
So that you can ensure adaptation.
Right.
Because you need that to close the innovation gap. This is a beautiful public, but they're in the forefront. And we have to be realistic. There is an innovation gap. And you can close this gap by involving the ones that are going to use it, either the patients or the healthcare professionals. So that's the second thing that I would look at.
Right.
And the third thing, maybe a little bit, the economics. Is there a possibility to scale it up?
Sure.
Is there a viable model that you can really put it on their own feet?
Right.
We say in Dutch. Can it be
Right.
sustainable?
Right. Right. Well, I think
But
that
first of all, people and co-creation, they're
Right.
the main things. Yeah.
Well, I think that you echo a lot of the sentiment that probably a lot of the people here in this Innovation Lab espouse. It's about the people that come to create, and it's the people that you're ultimately serving.
Exactly.
Makes it worthwhile.
Venues like this help,
Right.
where people meet up. We have our own platform, it's called Mobile Doctors, where we bring all the doctors together that are in the forefront of developing and trying to see or make them work together, exchange information, and really, really push it forward. And then, therefore, you need people that are glad in interacting with other people, feel comfortable.
Absolutely. So
Yeah.
that rapport is so critical. Well, Barbara van der Kolff, it was delightful talking with you. And thank you so much for coming all the way from the Netherlands to be part of this experience. I know that you and your team have added greatly to the environment here and sharing the knowledge that you've brought with you. Everybody, my name is Kate Warnock. We're here at the Guidewell Insights Lounge. Please join us again soon for another interview. We'll be back.